Of April 1st, all restaurants and commercial facilities that serve food are prohibited from serving food to customers in their premises. Restaurants and other commercial facilities can prepare and serve food for delivery or takeout only. The operator of that restaurant must ensure that all persons maintain appropriate social distancing from one another when picking up their food. Grocery stores will remain open, but they must also maintain appropriate social distancing between their customers. Bars will be closed. Personal service businesses such as hair salons and massage therapy offices will be closed. All businesses that are not listed in the schedule of critical services that accompanies the order must close between April 1 and April 14. The closure does not prevent these businesses from operating on a remote basis. A business may accept orders on the internet or over the phone for delivery or pickup as long as the employees are not working at the place of business. The order does not prevent employees or others from coming into the business to perform such things as repairs, to provide security services, or to take out items from the business premises if the business is going to operate on a remote basis. Nothing in the order restricts the operations of delivery of services by the federal, provincial, or municipalities. Nothing in the order restricts any activities of a publicly funded agency, organization, or authority that delivers or supports government operations or services, including healthcare services. This means the order does not affect institutions, agencies, or other service providers who provide healthcare services, such as hospitals, regional health authorities, and private agencies who provide a range of health services. All businesses listed in the schedule of critical services that accompanies the order may continue to operate. If these businesses allow members of the public to attend their place of business, the operator of the business must put in place measures to ensure that appropriate social distancing rules are followed. This order does not affect how members of the College of Physicians and Surgeons of Manitoba, the College of Registered Nurses of Manitoba, the College of Licensed Practical Nurses of Manitoba, or the College of Midwives of Manitoba provide healthcare services under the order. Any other health professionals may continue to practice if they are providing services for a publicly funded agency, such as a government or regional health authority or a business listed under the schedule. In addition, healthcare providers can continue to provide emergent or urgent care. Municipal taxi services or municipal transit services, taxis, and other private vehicles for hire can continue to operate. The operator of the vehicle must ensure measures are taken to ensure reasonable separation between persons within the vehicles. It's difficult to list a specific distance, but a reasonable level of spacing is expected. This order repeals previous orders, so there's only one public health order in effect at any one given time. We are seeing the ongoing transmission of this virus in other jurisdictions. We're seeing the community-based transmission in other jurisdictions, and so we need to continue to adapt our response to this virus. We need to continue to escalate our social distancing recommendations and all our measures to protect ourselves, protect others, protect our communities, protect our healthcare workers. These measures are yet another step to limit the transmission of this virus and to flatten that curve. The most important way of reducing the spread of this virus is for people to stay home. If you're able to stay home, wash your hands frequently. This is especially important if you are ill. It's especially important if you're in a high-risk category, such as those over age 65, those with underlying medical conditions, or those with immune compromise. If you cannot stay home, you need to practice social distancing, physical distancing at all times. I want to remind Manitobans that we are not helpless against this virus, that actions such as these are in place to limit the effect of this virus on our population. Now is not the time for fear. Now is a time for knowledge. Now is a time for action. And these orders are furthering that action that we've been taking all along to be proactive and out ahead of this virus. So thank you to all Manitobans who have already stepped up, and thank you to Manitobans who will continue to help us in our battle against this virus. Thank you, Premier.
Thanks, Brent, and thank you so much to you and Lynette for your ongoing work and for the work of your teams. We very much appreciate it. I know Manitobans have expressed to myself and many of the members of the Legislative Assembly how appreciative they are. And so I just say to you, thank you for your focused efforts on our behalf. If there are any questions, we can take those now.
Thank you, Premier. Just a reminder to media, there'll be one round of questions and no follow-up questions addressed to the Premier, please. From CTV Winnipeg, Michelle.
Hi, it's Michelle Goins, CTV. I'm wondering why only have this up until April 14th?
So this is our response for right now. Certainly, we've been flexible and adaptive in our response. So we are having this in place at April 14th for now, but we are constantly reviewing all of our strategies, and we will extend if necessary.
From the Winnipeg Sun, Josh.
Just looking at these closures, I know there's been a number of federal packages out there to help support employees who have been laid off and all the rest. Are there any plans to support these businesses that do have to close completely, that are not going to have any income coming in, so they can do things like pay the bills that they have to pay rent? So are we looking at down the road any kind of rent relief, especially a lot of these businesses who may not have the ability to take on extra debt or a lot of extra debt to cover these costs?
Yeah, it's a good question, Josh. We're waiting for more detail. We heard the upgrade of the federal percentage on wage relief for businesses on Friday, which was well received. There were premiers, including myself, who pushed very hard for the initial offer of 10% to be raised significantly because we didn't feel that was going to work or have any uptake. That offers some assistance, I think, to small businesses who are in that category of being able to maintain their staff to as great a degree as possible and avoid layoffs in the first place. So we're waiting for more detail on that later today, I hope. So we'll be able to see where that fits in with other programming, but certainly other programming possibilities are on the table and being examined. And we are mostly focused right now, of course, on making sure we're as prepared as we can be to protect the health and well-being of Manitobans and vulnerable Manitobans in particular, now and in the future.
From CBC Manitoba, Bartley.
Premier Pallister, Bartley Keevis at CBC here. Why hasn't Manitoba provided more of its own measures in terms of financial assistance to businesses, workers, and renters?
Well, we have taken numerous actions, well over 150 so far in the last 3 weeks in respect of various measures. Some of them are cash offsets, some of them are modifications of existing programs to move resources where they're needed. Some of them are assistance direct and indirect to daycare, for emergency personnel and the like. We're working in partnership, obviously, with the federal government. It's a federation. The federal government has already introduced some programs, and we expect more to come to protect the national economy. We're in charge of protecting our healthcare system for now and for the future. And so our measures are significant, and there are more on the way.
From the Canadian Press, Steve.
Steve Lambert from the Canadian Press. Premier, we've seen in other provinces they shut down non-essential retail outlets and businesses, and then the exemptions are quite numerous. Liquor stores stay open, cannabis stores stay open. We haven't seen the schedule yet, but am I to assume correctly that liquor stores will remain open, cannabis stores will remain open, and things that some people might not deem essential will stay open?
Well, I think what you're going to see, I'll share with you a little bit of a summary on this now, but I'd encourage you to go to engagemb.ca. You'll be able to review the entire act. It does follow somewhat similarly, I think, to what other provinces have done in some respects, but it was designed with Manitoba input, specifically from our people closest to the small and medium-sized enterprises. Closure is now going to be required for in restaurants, hotel and motel restaurants, but delivery will be available. Fitness centers, yoga studios, garden supply stores, sporting goods stores, tutoring services, hair salons, barbers, nail salons, personal care services, to some degree chiropractic, dentist, physio-optometrist, all previously notified. They'll still be able to offer in those medical fields urgent and emergent services only. In terms of no closure required, grocery stores, banks, pharmacies, public transport, with the caveats that the doctor has mentioned earlier about social distancing, physical distancing, I should say. Hotels and motels for lodging, laundromats, home services, contractors, veterinarians, kennels, farmers markets, food banks, shelters, and so on, and manufacturing businesses as no closures required. This is our preliminary list based on the research and planning input that we received from business leaders around the province. But I would not suggest that there would be absolutely no possible changes in the future or modifications to it. And so because we're an incredibly diverse province economically, I would encourage Manitoba small business people or those who work in small businesses to go on engagemb.ca. And if they have other suggestions on measures that they think we should be taking to adapt our situation to make it work better, to protect the safety and well-being of people, I am very interested, and I know our government's very interested in hearing those.
From CJOB, Diana.
Mr. Premier, Diana from 680 CJOB here. On a slightly different note, I know we're seeing quite a few people outside these days as far as wanting to get outdoors in the nice weather. We're seeing very busy parking lots at parks, tons of people on the trails. What are your thoughts on this, and is it possible we might see some further measures on physical distancing or see restrictions on kind of outdoor spaces if people are getting outdoors kind of in droves and maybe not respecting that physical distancing requirement?
Thanks, Diana. Thanks for raising that, because it's a really interesting issue, and I think it allows me to highlight the importance of all of us working together to educate one another on these measures, to make sure that we're encouraging each other all the time to remember. Old habits die hard. My wife and I like to walk holding hands, and we realize you can't do that. That sets a bad example, so we've stopped that. But there are other examples as well. And I think making sure that we don't do anything but encourage people to exercise all the time practices like good hand hygiene, like the physical distancing you talked about, is really important. On the other hand, we don't want to have to close down all parks, playgrounds, and outdoor areas, because people have already told me they're getting cabin fever and would like to get outside in a beautiful, what we hope will be soon, a beautiful Manitoba spring. So I'm calling on Manitobans to make sure that they practice these measures and that they coach one another to do the same. We need to respect the fact that we can save a life if we do this, and not many generations have the opportunity to do something like that. You can save your own life and you can save the lives of others by practicing the physical distancing measures that we have been promoting so much. Those are the fundamentals of dealing with this issue. This is how we beat this thing.
Next, we have Larry from the Winnipeg Free Press.
Mr. Premier, Larry Cush at the Free Press. Do you have an estimate of how many businesses in the province are affected by this latest order, or the number or the percentage of businesses affected by this order today?
Larry, I don't. I have a good understanding that we need to take these measures in all of the businesses so named, that it will protect the health and well-being of others. And I'm proud to say that I have seen and I have had reported to me so many examples where these businesses have already taken measures, some of them to close in advance of this order, some of them to go above and beyond the physical distancing requirements, others to protect their employees with specific measures. I know the employers and the employees in small businesses across the country will support this measure, as difficult as it is, because they know that what will result is better health and safety protection for all of us, and the protection of our healthcare system out into the future as well.
Next, we have Brittany from Global News.
Good afternoon, Mr. Premier. On Friday, we heard of two high-ranking WRHA officials who had traveled before the ban was in place, but while there were cases in the country of COVID-19, and are now in self-isolation. Just wanted to get your thoughts on examples being set by that, and what your thoughts were of people still traveling just before a pandemic was declared.
I think there'll be lots of room, Brittany, for armchair quarterbacking. I'm not going to add to it. We've made the directive very, very clear to all government employees at every level that they need to adhere to the recommendations and follow them closely, and that's what we're seeing and experiencing. Today is about the private sector, but we need all hands on deck. We need all hands washed, too, on a regular basis so that we protect each other in that way. The measures that we've taken are designed to apply to those returning to the country, and that's the protection we need from them. We need cooperation, 100% cooperation from all who are returning to the country or traveling interprovincially to do the self-isolation, to follow the guidance of the doctor and Lynette in respect of how to protect ourselves, but how to protect others as well. And thus far, although there have been some sad exceptions, in the vast majority, Manitobans are following these directives. We're going to need to continue to do that and not take our foot off the gas. This is not a sprint. This is a marathon, and we need to make the necessary steps now to make sure that we keep that slope on COVID down.
From City News, Stephanie.
Mr. Premier, Stephanie Lucic from City News. Just wondering why now? It seems like some other jurisdictions were further along in their fight against the pandemic before they made this kind of public health order. I'm just wondering why now for the public health order.
Well, every province at different stages, Stephanie, I think, in the battle, and we're all working together cooperatively, but some of us did more earlier. Certainly, we were the first to order equipment, protective equipment. We're the first to really promote through educational mechanisms, I think, effectively, and with your help, with the help of the media, get the word out on the fundamentals, which I am clearly hammering today, and make sure those are followed. And those practices will pay dividends down the road. And as we continue to move forward with better availability of testing and improving the turnaround time for calls and lessening the wait time when people need information and improving the response rate, the rapidity of the response when tests are done, each of these measures is going to assist us. So we're injecting more resources as a government in each of those categories and many, many more to make sure that we're doing a better job of heading this thing off. I think there were 3 or 4 other provinces that announced restrictions of various kinds on this. Frankly, some of them are far along in terms of cases at a different stage in the cycle than we are. But we feel these are prudent steps to take now, and these are the measures that we've had recommended to us, and I support the doctor and will implement them.
From CBC Radio Canada, Patrick.
Oui, hi, bonjour. Patrick Foucault from Radio Canada. Mr. Pallister, thank you first of all for giving us a French statement in your introduction. I have another French question for you. I don't know if it's possible for you to answer in French. Basically, you answered that in English, but what kind of financial help will the province provide to those businesses and companies who will be financially affected by that?
Well, je vais continuer à coopérer et partenaire avec le gouvernement fédéral. La responsabilité principale du gouvernement fédéral est pour préserver l'économie du Canada et pour notre tâche, la première responsabilité est pour préserver le système de santé. Et la coopération entre les 2 niveaux de gouvernement, c'est très important pour nous.
Merci.
From 102.9 CHTM, Nabby.
Good afternoon, Nabby Ball with 102.9 CHTM. Mr. Premier, last week you announced the freeze on rent increases and suspension of eviction hearings for renters. Is the government considering adding similar measures for business owners who rent property, especially in light of today's announcement?
Yeah, it's a very good question. It's a very difficult question as well. We have thousands and thousands of businesses in Manitoba, each with different rental or lease agreements, some who own their own properties and have mortgage payments. And the cash flow demands on small business are real. I know I come from a small business background and a farm background, so I totally get this. So that's why I've said earlier that we're working in partnership with the federal government to determine the nature and detail of the programs they're offering. There's not a lot of point in working without that cooperation, because if we have programs that are confusing, then small businesses won't know how to get help. At this point, we have some clarity on some of the federal programming. We've already focused on preserving the needs of our more vulnerable people as a priority. And as we move forward, I would suggest two resources that Manitobans can use to get updated information. First of all, you could just go to engagemb.ca for initial information on today's announcement, but there's also additional information that will be available on there that will be very helpful to you if you are a small business owner or work in a small business. And secondly, use the resources of your chambers of commerce. And I will put this advertisement in right now shamelessly as a former Chamber of Commerce president myself, and say, your chambers of commerce are a tremendous resource to you, and if you're not a member, you should join. Because the Manitoba Chamber and the Winnipeg Chamber, as well as the Canadian Federation of Independent Business, and for larger companies, our Business Council, are excellent, excellent organizations that act as a great resource to you, and can in this instance as well. And I'm sure they'll also be tremendous allies in helping us to get information not only on proper hand washing and what to do in terms of coughing and sneezing, but also in terms of the supports we need and the information we need to get through this together. All of us, all hands on deck, all clean, well-washed hands, of course.
Thank you.
From the Brandon Sun, Drew.
Thank you, Mr. Premier. This is Drew from the Brandon Sun. Can you comment on why this order was issued now? Like, what changed over the weekend to make this necessary today?
Well, there's not a magic manual for dealing with this pandemic, because we don't have any, apart from maybe the Spanish flu over 100 years ago, we don't have really an identical scenario or one that's that close. We have dealt with disease before, we've dealt with epidemics before, but the magnitude of the potential consequences of this one are greater than anything we've seen, most of us, in our lifetimes. And so I would suggest that our timing is appropriate for Manitoba and may not be appropriate for BC or PEI. But it is appropriate timing. It's not an easy decision to make, and it is the right decision. And we're taking it in the right way at the right time with a little bit of notice, so our small businesses and their employees can adjust and adapt as well. And that sensitivity that we've used in the past on changes in the school system, changes in childcare, changes for the private sector, changes in the public sector to allow people to transition to working from home, is assisting us in, I think, dealing with this in a way that recognizes the more we can do proactively, the less we'll have to do reactively. And the more we can do to instill confidence in our people, the less stress they'll have to put up with that's unnecessary. We're trying to alleviate that stress, not just with a call line to help you if you need help in counseling, that's coming up soon, but in terms of consistently, and Dr. Roussin, Ms. Saragusa deserve to be congratulated on this, putting information out there that Manitobans can see and have faith in, that will assist us in dealing with this on the basis of facts, on the basis of science, and with foresight.
From the Flin Flon Reminder, Cassidy.
Good afternoon. This is Cassidy from the Flin Flon Reminder. I'm noticing that it appears that mining operations are included in essential. Can you kind of walk me through that decision?
Well, I think it's been customary in the other jurisdictions as well, Cassidy, that's been the case. I'd also say, though, that for Flin Flon, I think this is a good example of where the reasonableness of decision-making to suit Manitobans' needs shows up, because you've got Creighton across the way. If we had a 2-week isolation for everybody who went over to Creighton or came from Creighton to see you, we wouldn't be able to operate either community very effectively. This is one example of where the doctor has shown, I think, in his adjudication of the situation, some some excellent sensitivity to realities facing Manitobans, and particularly Manitobans in Flin Flon area.
From the Thompson Citizen, Ian.
Yeah, hi, this is Ian from the Thompson Citizen. I'm just wondering how this order applies to public transport like bus lines and airlines providing service between cities. Would they have to possibly limit the number of passengers they can have on in order to comply with social distancing if they're still allowed to keep running?
Right, so they are allowed to continue to operate. They are expected to provide a reasonable spacing between clients. And so this isn't, a specific number isn't provided, but it is expected that a reasonable distancing should be accomplished on all of these transports.
And finally, from CKDM, Matt.
Matt Hamill from 730 CKDM. I was wondering if, this closure of non-essential businesses, is there anywhere, if someone in the community notices that a business is still operating, is there some sort of way to report that? What do citizens do if they're concerned?
Yeah, I'm sorry, Matt, I don't have that right in front of me. I'll see if we can get it while I'm still talking to you. We have an email address that you can call. Well, you know what we'll do? We'll put it on Engage Manitoba right away. If it's on the engagemanitoba.ca website, for information for folks, if they see non-compliance and they can report it, that's good. And as I said earlier, and we've had tremendous support and cooperation from the small businesses in the province, so I don't want this taken the wrong way, but if small businesses are not doing what they need to do, one thing you can do to help is to tell them that they're not doing that and to tell your friends, because there are other choices out there. If businesses are not respecting the health needs of others, including their customers and employees, then it's important that you let your friends know that at the same time. But we'll get that put on the engagemb.ca website right now so that you'll be able to share that with listeners or readers as the case may be. I want to say thanks to everyone. Thank you, Doctor. It's a pleasure. We appreciate it. I wish we would have met under different circumstances. But that being said, it's a pleasure to be working with you in the best interest of Manitobans, and I say thank you to you again.
Thank you, Premier.
All right, if everyone wants.
Okay. Well, good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today, we are announcing 24 new cases of COVID-19, bringing our total to 96. The total number of deaths related to COVID-19 remains at 1. At this time, there are 4 individuals receiving care within hospital, one of which is in intensive care. All others are recovering at home. We have 2 individuals that are listed as recovered. Public health investigations are continuing to confirm details, and as information is received, we will update that on our website. Over the weekend, a total of 1,430 tests were completed at Chatham Provincial Lab, bringing the total to date to 8,550 tests. I understand there's a mobile testing site in Dauphin opened at the MPI building this morning. Lynette will be able to speak more to the logistics of those sites, but I want to ensure that public health officials are engaged in developing these sites, and these sites do not pose any risk to the public. Remember that this virus is spread through close, prolonged contact, coming within 1 to 2 meters of an infected individual. So certainly at these sites, our professionals who are performing the assessments and testing will be within that range and will wear the appropriate protective equipment. But the public is at no risk due to the location of these sites. So again, this is a time for credible information, not fear, not panic. And so these sites do not pose a risk to the public. That's particularly true of drive-through sites where these individuals are not even leaving their cars. But again, this virus is spread through close contact, so there is no need for the panic to be or the public to be concerned about these sites. I want to be clear that we do not release personal health information about individual cases unless there is a public health reason to do so. Upon receipt of a positive test, public health does a thorough investigation of the case, ensures they are isolated, does a thorough contact investigation, including places attended during the infectious period. Should any information arise that the public needs to be aware of, public health will definitely disclose that information. Public health will definitely disclose that to contacts of symptoms to watch for and the need to self-isolate for 14 days. But we do not share personal health information unless it is important to the health of the public. We continue to enhance our messaging on physical and social distancing. You've heard of the new orders that are in place today and some that will take place in effect on April 1st. These is our important strategy in trying to interrupt the transmission of this virus. Stay home if you can. If you must go out, please practice social distancing at all times. Wash your hands, keep 2 meters from other people. Stay home if you're sick. Stay home if you can, certainly if you are in a high-risk category of those over age 65, those with underlying medical conditions, or with immune compromise. There's also questions we receive about notifying the public of specific locations within a geographic region of clients. Again, we will do so if there is a public health need to do so. But as we are enhancing our social distancing messaging, if you were aware of a case within your town or city, you should practice social distancing. If you are not aware of such a case, you should practice social distancing. So it does not help the public to know the specific locations of these cases because we're asking everyone to stay home, practice social distancing at all times. If there was a reason to announce where a specific case was in a location, public health definitely would do so. Please do not share unfounded rumors. We know that this now is not a time for fear. This is a time for credible knowledge. We see in much of the social media to it's easy to share stories that may not have been corroborated. So really this only instills fear and sometimes panic. So we're encouraging everyone, just go for credible information. Visit our website, manitoba.ca/COVID-19, but don't share unfounded information. I've mentioned it many times that we are not helpless against this virus. These steps that we continue to take are limiting the transmission of the virus. We've enhanced the public health orders today. Further enhancements take effect April 1. This is to interrupt the transmission of the virus. Manitobans are taking action now to limit the impact of this virus. By doing so, we're protecting ourselves, the people around us, our community as a whole, and we're also protecting our healthcare workers. Our healthcare workers are at the front line being heroes to Manitobans, but putting themselves in line of this in the line of this virus. So we want to protect them as much as we can, stay home, practice social distancing, and we're going to be improving the outcomes for many, many Manitobans. And again, I'll end by thanking all Manitobans who have already stepped up taking these measures. We know it's difficult. We know that starting April 1, the difficulty level may raise for many people. You're doing your part to essentially save lives in Manitoba. And so we really appreciate that. And all Manitobans are going to continue to ask us to work together in our battle against this virus. So thank you. Pass it to you.
Thanks. Good afternoon, everyone. I'm Lynette Siragusa. I'd like to start today by giving a special thank you to Pam, Mark, and Hudson DePaul of Patterson Grain in Culross, Manitoba, as well as Chad and Melissa Schmidt from East Creek Farms. These two families reached out to their regional health authority, Southern Health Santé Sud, on Friday and donated 295 respirators. On behalf of all healthcare workers, I want to thank the families for their generosity. It is clear that public health emergencies bring out the best in our communities, and donations such as these are excellent examples of how companies and individuals can step up and support us. We know that the expanded health orders will have an impact on many businesses, and that the effects of COVID-19 are being felt far beyond health providers working throughout the province. So I do just want to express our appreciation and continued support from businesses who are offering their supplies, including the N95 respirators, for use in the health system during this challenging time. We've also received businesses offering to help and specifically ask how they can donate some of their supplies. So one example is Canada Goose has volunteered to make apparel for our healthcare workers. And we are working on a more formal process so that when donations come, there's a process that they can follow, and we will have more details available tomorrow. The requirements and challenges that we face change daily, and they require swift action and constant surveillance and contingency planning. So I want to be clear that we are adequately supplied right now. We have stocks available, but we have to continue to take every step to make sure that we maintain preparation for a virus that has overwhelmed health systems in other parts of the world. Part of the challenges that are coming to us right now is that some borders have closed and some production has stalled in certain parts of the world, which affects our ability to source and acquire the equipment and supplies that we need. So our logistics team, to give you some perspective, who order our supplies, and we meet with them every day, and they continue to say that we are good, and we believe that, but they have had to be very creative in their purchasing. So normally in our normal world, they would deal with 60 vendors, approximately 60 or 70 vendors. And for the past few weeks and months, they now deal with 600 vendors across the world, trying to make sure that they have what we need to protect our staff and the public. So it's just an example of how we need to keep working together and to get through this. So for any company who has supplies on hand, even if you're not sure if they would be useful, we'd be happy to connect with you. So look around and we will give you more details tomorrow on how we can connect you in. Just to give you an update on operational matters, so our online self-assessment tool had 8,000 web views yesterday, and since we launched it on March 17th, the English and French versions have received almost 350,000 views. With the weekend now over, Dynacare is back in action and will be calling patients to confirm that they are negative, and will provide them with some information as well as to what they need to do if anything changes. So keeping up with the very much increased lab volumes, so that it's good to have their partnership. And I do want to remind everyone that if you are COVID-19 positive, public health will call you immediately as soon as they get those results. So just so you know, that is our top priority. Community testing site, a new community testing site will officially open in Pine Falls at Ecole Powerview. Hours are 9 to 4, Monday to Friday. As Dr. Roussin mentioned, Dauphin now will be opening as of, I think, 1:30 this afternoon, their testing center at the MPI Service Center. And this is open from 10 till 3, 7 days a week. And just to remember that these are testing sites that require a referral. These are not walk-in clinics. Another update I wanted to provide for you was with regards to the RAM clinics, so the Rapid Access to Addictions Medicine clinics. They provide a valuable service for those struggling to overcome substance use addiction. So despite COVID-19, these services are going to continue at all locations throughout the province, but there will be some modifications. So whenever possible, they will try and have virtual or phone visits, but for those that need to meet in person, they will be scheduling and staggering appointments so that they can respect the rules of social distancing and limit the number of people in the waiting rooms. For some of the smaller RAM clinics, they are limiting entry for clients only. So for those patients who typically bring a support person or a loved one with them to these appointments, they'll be able to participate, but virtually, not in person. And that's all I have today, so we can open it up to more questions. Thank you.
Thank you. And a reminder to reporters, please identify yourselves before you ask the first part of your question. And then, of course, you have a follow-up question for this session. From CTV, Michelle.
Hi, Michelle, going from CTV. Just wondering about the message to people going to the cottage. We've heard from the national not to go to cottages. Does this have to do with rural hospital capacity?
Right. So I think that there's a number of things there with the cottage message. I think that one is that now is not the time to travel, right? Now is the time for social distancing. Now is the time to stay home if you can. The other issue there is that traveling to the cottage to rural areas where you might be seeking health care should you need could potentially overwhelm those areas should you get ill. So the messaging is there that right now it can be difficult times. We know everyone is finding some challenges with this, but the message is now is not the time to be traveling. Now is the time to be staying home. Now is the time for social distancing.
Thank you. And then also, when it comes to ages, are any of the people in hospital under 40. Can you tell us a little bit about their ages at all?
So I get reports of hospitalizations as soon as they come into public health. I don't have all of that information on me right here. I think that going forward, we're going to try to be able to list the age range of individuals that are in ICU or in hospital, but I don't have that right now. But we're going to look to have that.
From the Winnipeg Sun, Josh.
Hi, it's Josh Aldridge, Winnipeg Sun. We're a little over, I guess, about a week and a half left or so of schools being closed and child care centers being closed. Is there much more thought to keeping them closed longer or just shutting them down for the school year, considering if we do that, teachers will probably need time to prep and put things together for their students?
Yeah, there's definitely thoughts going on, and you'll likely be hearing some more information on that in the near future.
As my follow-up, are we getting any sense of how long these types of orders are going to need to be in place, just so people have an idea? I've heard everything from a few weeks, and most people are now saying months. Some jurisdictions saying 6 months. What's kind of the prognosis on that, whether not just in Manitoba, but looking at models from across Canada and other parts of the world?
Yeah, it's tough to give a solid figure on that, but social distancing strategies, they'll need to be in place for many, many weeks to have a strong effect. What that exactly looks like may be different in different jurisdictions. But we're not looking at these strategies being just a couple weeks. Now, the overall strategy could change within there. There could be some rotating of the strategies within that time frame, but we are looking at some methods of social distancing for many, many weeks.
From CBC Manitoba, Bartley.
Dr. Roussin, Bartley Kivas, I don't know my own name, that's CBC here. A couple of weeks ago, you talked about a three-week benchmark after the first reported case of COVID-19 based on the model you were looking at being when you would see community transmission. Are you expecting it now? And if not, when?
Right, so we know that it is coming. I can't confirm sustained community-based transmission right now. But as these numbers continue to climb, as more and more of this virus is introduced into the community, we are going to see community-based transmission. And when that exactly occurs, it's difficult to pinpoint that. But within this this week, within the next couple of weeks, we fully expect to see that, and we'll keep everyone informed when we see sustained community-based transmission. But a lot of these steps are typically taken once you see that. So we've had the schools suspended. We're now taking measures to close non-critical businesses. So these are the typical things we put in place once we see sustained community-based transmission. So we are a bit ahead of things here.
All right. On a similar note, when does the healthcare system expect to see the surge that we've already seen in some other North American jurisdictions? Is this still expected end of April? Is it expected in May? I know that there is specific healthcare planning being done. All reporters should probably have their own healthcare sources. When will that surge be expected in the healthcare system?
Yeah, and again, it's really difficult to to speculate at that. We've been prepared right from the beginning. We've been preparing for since February to be able to respond to any such surge like that, and we continue to prepare over time. And a lot of our actions are we're hoping will give us more time to prepare even. And so it's difficult to predict. We know that once we see community widespread, sustained community-based transmission, we're going to expect to see that surge in cases. And then when you see a surge in cases, a small but predictable amount of those cases will need hospitalization.
Thank you.
From the Canadian Press, Steve.
Hi, it's Steve Lambert from the Canadian Press. I've got a question specific to N95 masks. Alberta last week announced a protocol that appears to allow healthcare workers who conduct nasal swabs to wear N95 masks. Here in Manitoba and in other provinces, they're given surgical masks, but given the very close distance that one requires to conduct a nasal swab, why are nurses here not given N95 masks?
So the N95 respirators are specifically required for aerosol generating medical procedures. We follow the guidelines that were developed by the Public Health Agency of Canada as well as the World Health Organization. And we do appreciate that there can be some difference in evidence, but that to us was the best evidence available. And we also relied on clinical experts within the system to let us know, further look up research, but also give us their clinical guidance. And it was determined that that would be the direction we would take.
And as a follow-up, we've seen in other jurisdictions, China, the U.S., Italy, healthcare workers falling sick and dying. And is Manitoba properly giving people personal protective equipment to healthcare workers, even those who may not be, according to guidelines, facing what would normally be a danger requiring a respiratory mask? Are we not? Should we not be erring on the side of caution and giving people extra protection, given what's happened elsewhere in the world?
Making sure that our staff and the public are safe is our number one priority, and we are relying on evidence to guide our decisions. So in a time where equipment is limited, we have ordered enough, more than enough, and we continue to search and find and get more N95 masks or whatever it be, even surgical masks and gloves and gowns, so that our staff are protected. It's very important that every staff member understand how to don and doff their personal protective equipment. That is a key part of protecting yourself, and also changing out the masks in appropriate timelines. So we would never put our staff or the public at risk, and we are following the evidence that we have available to us, as well as clinical guidance from our experts.
From CJOB, Diana.
Good afternoon, Diana Foxwell from 680 CJOB. Dr. Roussin, as far as the services that are to remain open from April 1st to April 14th, how did you come up with that list? Did you kind of take Ontario's list and kind of use that? I haven't read the whole way through, but it does look very similar. Is it kind of something you based off of other jurisdictions, or did we just go and kind of decide what was needed here?
We did look at other jurisdictions and the type of businesses that they included and excluded from their orders. And then we took time here to put a Manitoba lens on it, and we had a lot of engagement from many partners to look at what a appropriate list is. And then just like any of these orders, we're going to revisit it and see what's working, what isn't, and if there's any changes that need to be made.
And just as a follow-up, say someone is under isolation at home, maybe they've tested positive for COVID-19 and then they recover. What does it look like sort of them going back to their daily life now that they are testing negative or they've been considered recovered? Obviously, with the social and physical distancing guidelines, it seems like they may kind of just be told to maintain similar isolating principles, or what does that look like when someone is recovered from COVID-19? What does public health tell them?
Right. So so someone who is at home recovering from COVID-19, which the vast majority will, 80% of cases were likely to just recover and improve at home. After 14 days from the date of onset of their symptoms, and if they have no further symptoms, then they would be released from self-isolate or from isolation. And so the issues regarding social distancing still apply to us all, but they wouldn't be under a public health isolation at that time. So if they perhaps worked in a critical business, then they would be able to return at that time.
Thank you.
From the Winnipeg Free Press, Larry.
Larry Cush of the Winnipeg. So, Dr. Roussin, I'm wondering, has public health completed its investigation into the workplace where the woman who died of COVID, have you looked into the workplace, and can you tell me whether any of her coworkers have tested positive?
Certainly, the investigation on that case would be completed, and if the person was infectious while they were at work, then definitely the workplace would have been involved in the investigation, and any coworkers who had close contact with that individual would have been contacted and advised to self-isolate and monitor for symptoms. So it's a typical investigation, and if just like any individual, if they were symptomatic while at work, then that investigation would include their workplace. So we have a number of cases ongoing. I can't really speak to which contacts of which individual have tested positive, but certainly if that individual was ill while they were at work, that investigation would have been done.
My follow-up is there any particular concern or evidence to show that you're getting more cases connected to dental offices, dental supply companies, especially since there would have been a number of people from Winnipeg and Manitoba at that March 5th, 7th conference, big conference, dental conference in Vancouver. Is the dental, either dental offices or dental supply companies, a hotspot?
Well, I can't describe it as necessarily the hot spot. We know that hearing about cases in many jurisdictions regarding that conference. We now know that we are past the incubation period of that conference. But certainly that conference, I know of many jurisdictions reporting cases from there. I don't have in front of me a number of cases linked to that. We haven't really been. Our efforts haven't been really focused on disclosing that publicly. Certainly I know that in our jurisdiction, letters went out to all attendees of that conference weeks ago to advise of the need to self-isolate. But I don't have in front of me, Larry, a number of cases that are linked to that.
From Global, Brittany.
Good afternoon, Brittany Greenslade, Global News. Dr. Roussin, I know the Premier got asked about this earlier, but just want to get your take on it. Parks are full, parking lots are full, people out still playing baseball, throwing that around, people that are sitting in the backs of their cars with the hatches open to keep that 6 feet distance, but still, hanging out with other people. Is that social distancing, and can you give people a better understanding of really, I know you say stay home, but to really drive it home to people?
Yeah, I think that a strong message should be stay home for the most part, right? So if you can stay home, especially if you're ill, I would say especially if you're over 65 or have underlying medical conditions, stay home. We know that health is not only about this virus. And so staying physically active, getting in the outdoors as the weather gets nice is important as well. It's just really always keep in mind the importance right now of physical distancing. And so when you get to these parks, if you felt like going on a nature walk or a walk on a trail, but you get there and you see many, many cars in the lot, probably turn around. If there's a number of people there, this is not going to be conducive with physical distancing. So we want people out, we want people to stay healthy, Mental health is a big issue. But if there's a large group of people, you need to consider turning around and doing whatever you can to keep that 2 meter distance.
And my second question would be, I know that you guys are going to be putting online case data, including possible events and locations where people may have come into contact with a confirmed case. That currently is not up on the website. And as of right now, the last flight information with confirmed cases seems to be from 2 weeks ago. So of our 96 cases, well, you don't believe we're seeing sustained community transmission yet. Are we seeing any community transmission yet?
It depends on our definition for that. Certainly, we mentioned before that we've had a number of cases related to travel. Certainly, the vast majority of our cases are related to travel. We know that we've had cases that are directly linked to known cases. And so that is community transmission. It's just that when we know the transmission chain, especially if the original case was a from travel and then a close contact of that case, is identified, that is community transmission, but once you link it to a known transmission chain, it's not the type of transmission we're thinking about. When we see people who just test positive and we can't link them at all to travel or to a known transmission chain, that's making us think that the virus is just being transmitted then in the community. So right now we are investigating cases. And so I cannot say that we have sustained community-based transmission, but there are cases that we're still trying to link to travel or to other cases. And so we'll update frequently. And as soon as we can, when we look at some of the epidemiology, if we get the sense that we're seeing this community transmission, then we will make Manitobans aware of that.
From City News, Stephanie.
Dr. Roussin, Stephanie Lasuk from City News. Just wondering, as the lab ramps up its capabilities for testing, when we'll be able to loosen the restrictions on who can be tested?
Right, so right now we're testing certainly only symptomatic people, and that's likely going to stay that way. We're testing returning travelers from international or from interprovincial travel with symptoms. Now, any healthcare worker, regardless of their travel or contact history who are symptomatic, will be tested. We're doing the same for any hospitalized patients that are symptomatic with the respiratory symptoms. And then we're also in congregate settings or in isolated communities. So we have expanded that testing. As we move forward, as we see the dynamics changing, then we may extend that testing further. Right now, that's our testing criteria, and we're continuing to work with the lab. The lab is doing an outstanding job at implementing many innovative strategies to try to increase their testing volumes. And as we see that, as we see the demand rise, as we see the changing dynamics, then we'll adjust our criteria as well.
Right, but do you have a ballpark of when that might be, when it might open up to all symptomatic people? You said community transmission is coming. Do you know if it'll be a week, 2 weeks?
It's tough to say, right? There's a lot of variables at the lab for that purpose. So, one strategy and many jurisdictions are using is once we see widespread community transmission, we know that the majority of people, right, 80% of people will have mild symptoms and can recover at home. So if we're seeing widespread community transmission, then staying home when you're sick for 14 days is another strategy. And so as we see that, those are some of the strategies that we'll put in place. But we're working with the lab, but I can't give you a definite date as when we're going to do that.
Okay, and then just a quick follow-up. I just wondered if you could give a general description of the kinds of businesses that are considered essential. This is a 74-point document with very specific descriptions, but just generally, when people ask, like, what is going to be considered essential that can continue to operate?
Right, the critical services. So you're right, it's a long list, and it certainly doesn't apply to government, so provincial, federal, or municipality. And then we're looking at, in broad terms, of supply chains, of certain manufacturers, goods and services for the household, right? Grocery stores will remain open. Certainly, healthcare providers in other healthcare professions open for urgent or emergent issues. But it's really to ensure that we have the necessary goods and services still available to Manitobans, while at the same time enhancing our messaging about social distancing, and then really closing those non-essential, non-critical services that we mentioned earlier.
Thank you.
From CBC Radio Canada, Patrick.
Hi, Dr. Roussin, Patrick Foucault from Radio Canada. Quick question for you. Is it possible that we can see eventually a measure that the one that is being taken in place in Quebec right now, where they announced that grocery stores would be closed every Sunday? Could we see something like that here?
Good. So nothing is off the table here. So when we place these orders in now, they're going to take effect on April 1. We have right now just in force for 2 weeks, but we know that sure could be extended. But we're going to continue to review these orders and see if there's other implementation that we need to do. Then we're going to do it, but we're going to do it based on what we're seeing in our jurisdiction.
Perfect. That's it for me. Thank you.
From 1029 CHTM, Navi.
Good afternoon. My question is for Dr. Roussin. In regards to the 24 cases that were announced today, as well as the 36 give or take cases that were announced between Friday and Sunday, can you in the very least confirm whether if any of these are Northern Manitoba cases at this time?
There is one case in the Northern Health region.
And sort of a separate question, we've had a couple of calls to the station from people who live in apartments who are concerned about shared air conditioning or shared air ventilation units in their buildings and are concerned about air exchange. You mentioned before that this is not an airborne virus, but could you sort of clarify for those who are living in that sort of situation or that sort of building that they are, whether this is a concern for them or if these concerns are founded or not?
So that is not a concern. So this is spread by contact and droplet spread, so it doesn't get aerosolized under normal circumstances. We know in certain healthcare procedures it's a possibility to be aerolized, but in the community we do not see this virus be aerosolized. So you do not need to be concerned about forced air furnaces or any type of HVAC systems of the sort. This is contact and droplet spread only.
Thank you.
From the Brandon Sun, Drew.
Thank you. This is Drew Make from the Brandon Sun. Right now we're seeing, I believe, 9 confirmed cases of COVID-19 in the Prairie Mountain Health region. Does Manitoba Health have any sense of whether those are all travel-related or whether they might be also based on community transmission?
Yeah, we do have that information. I don't have that in front of me for all the regions. So, as the our contact investigations go on, we link it to either travel or to a known case if we can. But I don't have the Prairie Mountain Health numbers right in front of me.
Thank you.
From the Flin Flon Reminder, Cassidy.
Hi, this is Cassidy from the Flin Flon Reminder. I'm wondering if you can maybe walk me through, you are giving cases by health region and not getting into any more specific location from that. Why are you giving the health region then?
Yeah, I think that's just been typical practice for us to break it down by health region. I think it gives a little bit of a sense on the distribution in the province, but again, it's not to affect behavior because we want all Manitobans to practice social distancing at all times. If you were at risk of being in contact with a case, public health will be in contact with you. If public health was aware of a potential transmission within a certain site or geographic location that we were concerned we were not able to reach all contacts by typical methods, then we would announce that publicly. And so we break it down, give a little bit of that of the breakdown of the provincial numbers, but again, it's not really to change people's behavior. We want everyone right now, whether you're aware of a case in your town or city, to practice social distancing. Now is that time.
And is there any way we could get the numbers for the amount of tests completed in the northern region?
I think it is broken down that way, and we can get you that.
Okay, thank you.
From the Thompson Citizen, Ian.
Hi, this is Ian from the Thompson Citizen. I'm just wondering if the case you mentioned, the one case in the Northern Health region, was that among the latest 24, and when were those tests completed?
It was one of the new cases, and I don't know when the test was taken on this specific individual.
And just to follow up, if someone's in like a border community that regularly travels into a, community in Manitoba, like, would someone from, say, Saskatchewan ever be tested at a site in Manitoba if that was the closest site, or is it strictly divided by province?
No, the healthcare services are portable amongst the provinces. So if somebody from any province attended or from anywhere was in Manitoba and needed testing, they would that testing would be done.
From CKDM, Matt.
Matt Hamill, 730 CKDM. We have a testing site, a drive-through testing site that's just opened up here in Dauphin. It was originally scheduled to be opened on Saturday. I was wondering if I could get any insight into the reason for the delay, or I heard there might have been an issue with the facility, the MPI Service Center, but that is where it's opening now. I'm just looking for some clarity on that.
I think the Regional Health Authority is quite happy with the MPI structure and the facility, so I don't think that was an issue. I think there were some questions and concerns by some that needed to be addressed, and I believe that happened.
Okay. Was there any sort of negotiation with the municipal government, or can you say anything there?
Yeah, I don't have all the details, but there was work with members of the community and likely the municipal government as well.
Thank you.
Thanks.
All right, back to CTV and Michelle. Michelle, do you have other questions?
Yeah. I just wanted to ask again what your recommendation is on wearing masks in public. Over the last couple of days, we've kind of seen conflicting messages with this. So for Manitobans, what's your recommendation?
For Manitobans who are not ill, just in the general public, I do not advise wearing masks. I advise against wearing masks to the general public. We should save those masks for people who need them. Ill individuals, especially presenting to healthcare facilities, healthcare workers assessing and caring for ill people, where those masks should be used. Those masks do not provide benefit to the general public just wearing them out on your day-to-day activities. My advice is, if you're really concerned about contracting the virus, stay home. Wash your hands frequently. If you do go out, then maintain that physical distancing. The masks aren't going to be of use to you.
And one more. So there's an Ontario company making these quick COVID-19 tests called Spartan. The Ontario government has ordered hundreds of thousands of them. Is Manitoba also looking at that same order or anything anything similar to that?
I think our lab's been looking at a number of different options. I can't speak specifically to that specific situation, but the lab is looking at many ways of increasing our capacity here for testing.
From the Winnipeg Sun, Josh.
Hi, this is Josh from Winnipeg Sun. I think you just kind of answered this question, but do you know how long it'll take to get to potential full capacity for the Cadden Provincial Lab and what that looks like?
Well, I mean, their capacity has increased probably about 400% on this, so there isn't really a full capacity. They just keep increasing their capacity that they have. So we're not looking at a certain level to get to. We're just increasing it as we can. And then we'll adjust our testing strategy so that we ensure we're testing the most appropriate people within that capacity.
What's the biggest, or what are the factors in increasing that capacity? Are we looking at just having enough reagents on hand? Is it having enough staff on hand? What are the factors in determining that capacity?
Yeah, those are all factors. Up to now, the reagent has been one of the biggest factors, but there's many factors that go in. So the reagent is one, staffing is another, even the testing equipment such as swabs, viral transport media. As we test and test and test, all of those things have increasing demand. So it's multifaceted, but up to now, the reagent has been the major shortage.
From CDC Manitoba, Bartley.
Dr. Roussin or Ms. Sergis, last week the Premier hinted at the use of hotels for some unspecified reason. Are you planning on doing it as other jurisdictions are, using hotels as hospitals? Hotels are vacantly.
We're looking at different places where we can help people self-isolate if they're not able to at home, depending on where their setting is. So yes, the answer is we're looking at all options, hotels being one, but also beyond that.
But I mean, as healthcare though, not just isolation.
Sorry, what was the question for healthcare?
But my question was, are you looking at hotels for healthcare purposes?
Healthcare purposes, like providing
so place are you to divert either positive or not positive people into hotels. Are you going to treat them as hospitals? That was my initial question.
No, I think I think if they need a hospital, we're going to make sure they have a hospital.
Okay, my second question to Dr. Roussin. Last week you identified one healthcare worker as testing positive. Is that person a nurse? And what is the total number of healthcare workers in Manitoba who have tested positive?
Right. So the healthcare worker that I referred to acquired the infection through travel, and then really it was a non-healthcare setting for that entire period. So I don't have in front of me the total amount of healthcare workers. I mentioned that one because I knew of that one specifically on the requisition, but I don't have a list of that. We do our contact investigation on all of these individuals. Occupational health, infection prevention and control come into play if we have a healthcare worker that's diagnosed within the healthcare setting, and thorough contact investigation would go related to other staff, related to clients, but I don't have a number in front of me on how many cases are healthcare workers.
Provide that later, perhaps, to your media, please.
We'll look and see what type of things we're releasing.
From the Canadian Press, Steve.
Steve Lambert from the Canadian Press. Doctor, you've talked a few times about the information you may or may not be releasing. People are worried about, healthcare workers, people on the front lines, maybe the general public, given how fast this has spread in some parts of the world. Why are you not releasing information about where people might have been in the province when they were contagious, for lack of that's the right word, when and where people might have been at risk?
Yeah, well, we definitely will release that information if we feel that people are at risk. So remember, this virus is spread through close, prolonged contact. So to know that there was a case somewhere in your town shouldn't really change much what you do, right? You should be practicing social distancing. If you're determined to be a close contact with an individual, public health will be in contact with you. For healthcare settings, if we had a healthcare worker or another a known case that we felt could have been in close, prolonged contact with a number of people that we would say weren't able to identify, then we absolutely will announce that publicly and give people information. So it's not about won't release information. We'll release any information that we think will benefit the health of the public.
And to follow up on Bart's question, what if there have been healthcare workers who might have been contagious while at work? Can you say whether or not that has happened to date?
If that occurs, then we would be looking at the period of infectiousness, looking at all the close contacts during that time and the precautions taken. And if we felt there was a number of people at risk that we couldn't identify, then we will make that announcement and let Manitobans know that if they were in this certain location during this period of time, that they should be aware that they may have been in contact with COVID-19.
So there would not be a public announcement if you could trace what you believed were all the contacts?
For sure. That's right. It wouldn't be of benefit to the public to announce that if we knew that all the contacts have been identified.
From CJOB, Diana.
Dr. Roussin, it's Diana from 680 CJOB. Just a quick question. If you're under isolation at home, say someone had returned from traveling and is spending that 14-day period back home, what happens if there was to be something like an emergency where a water pipe burst or a furnace broke in that home? Would someone be able to come into that house and fix things, given that the person is under that self-isolation, or what would the situation be there?
Yeah, so it depends. Certainly, those type of services are not are excluded under the orders. So those services will maintain will be able to continue to operate after April 1. If a person is self-isolating at home but is not showing any symptoms, then these type of emergency measures could still take place. There should be adequate social distancing within the house, because remember, this is only spread through close contact. So that would be there. So if we had say a case that was isolating at home and something like this happened, we would have public health involved and make sure that any such repairs were done, but were done in a safe manner.
Okay, and then just a quick question with regards to obviously restaurants and cafes closed for in-person dining under the Public Health Act, April 1st, April 14th. What do you say to Manitobans who might be kind of concerned? Obviously, you can still order for takeout or delivery. Some people might be a little bit wary of that. What would you say to them? Obviously, that's still being available.
Right, so our supply chains are going to be fully operational. So food, grocery stores, even takeout and delivery from restaurants is not going to be affected here. So again, these steps are can be troubling to people, but we want these steps to we take these steps to make it clear that we are enhancing our messaging regarding the need for social distancing. So this may sometimes raise anxiety, but like we said, this is the time for action. And so these steps are necessary, but we do not need to worry about access to food of this nature. The critical services will be in place. They maintain our supply chains, but at the same time, we're putting measures in to limit the spread of this virus.
But Manitobans can kind of rest assured that it's not unsafe to order takeout, I guess is my question. Sorry, phrased poorly.
I didn't catch that last one, sorry.
Sorry, yeah, just kind of a clarification. Manitobans can rest assured that it's still safe to order food for sort of delivery or takeout. There's not.
That's correct. Yeah, this is still fine if you're going to pick up your order. Those operators are going to need to ensure that safe social distancing is applied within the facility, and delivery again is just a very quick delivery, and everyone should be washing their hands all the time.
Thank you.
From the Winnipeg Free Press, Larry.
Dr. Roussin, just following up on an answer you gave me to a previous question. You said the letters went out to various people who attended that Vancouver dental conference, and they were asked to self-isolate. I'm wondering, like, with such a big conference and so many attendees, why was the public not alerted to the risk of transmission from that particular event? And are you sure you were able to contact everyone from Manitoba who attended?
Yeah, I think that there was a lot of messaging through media about that conference. The messaging went out through the associations, so the dental association, and so I think the messaging was very broad, and that was the messaging that went out, and I think it did reach everyone that was affected.
Follow-up is on cancer surgeries. Are there any cancer surgeries in Manitoba now being postponed, and if so, what type?
In conversation with the surgery team, the only surgery would have to, they're looking at each individual case, and they would only prolong a surgical case if there would potentially be a negative outcome, in which case then it would proceed. So I can't speak to every individual type of surgery. It would be dependent on what the prognosis was in that individual person.
So only if there was a risk to the patient in doing the surgery?
A risk in delaying the surgery, it would proceed, right? So if someone had a type of cancer and needed surgery, we would not delay that surgery if it was going to result in a negative outcome. Does that make sense?
Only if delaying the surgery would produce a negative outcome, or if it wouldn't produce a negative outcome, by delaying, you're saying they might be delayed.
We do not want any negative outcomes for the patients in Manitoba. So if they need surgery, and a negative outcome would result from delaying the surgery, then we would not delay the surgery. We would proceed with the surgery.
Okay,
is that
thanks.
better?
Yeah.
From Global, Brittany.
No more questions from Global. Thank you.
From City News, Stephanie.
Dr. This is Stephanie Olsuk with City News. Just wondering, earlier in the press conference, you were trying to clear up confusion over community testing sites and that they don't pose a risk to the public. Just wondering if that had anything to do with the delaying of the Dauphin site opening.
Well, I don't know necessarily the details of this particular site on what happened, but we know that this is a time where there's a lot of misinformation, a lot of fear, a lot of anxiety, and so we're putting these sites together, and we've seen that they've been expanding over time. So we just want to make sure that the public is aware that these are not putting anyone in harm's way, that this virus is spread only through close contact, and so these sites are safe.
Thanks. Maybe I should direct the question at Lynette. Sorry, I wasn't sure who had more to do with this particular case. But Lynette, is there anything you can weigh on for this?
Yeah, so each regional health authority really takes accountability to operationalize these individual sites. So I was aware that at the Dauphin site there was a bit more communication that needed to be happening within the community, but I don't have all the details to that.
Okay, thank you.
CBC Radio Canada, Patrick. Patrick. 1029 CHTM, Navi.
Good afternoon, Abby Ball with 1029 CHTM. Apologies if this has already been asked, but I would just want to clarify where in northern Manitoba this one confirmed presumptive case is.
Right, like we've been saying, we've limited our identification to the health region. So there's a northern health region.
Okay. Thank you. One quick question. Is it travel related?
I don't know. The public health investigation just started on that yesterday, so I don't have all of those answers.
Okay, perfect. Thank you.
From the Brandon Sun, Drew. Okay, from the Flin Flon Reminder, Cassidy.
Hi, Cassidy from the Reminder here. I am wondering what goes into the decision on where to place a testing site.
Well, that's up to the regional health authority to look at their geography and what the population demand is and where their structure is available. So it might be in an existing structure, it might be in a structure that we don't typically use, and it's subject to change based on the demand. So when we first started with the testing sites, there was a huge surge of testing. We are seeing at some sites the numbers are coming down. So we'll just continue to evaluate and trust the RHAs as to what works best to make sure that their communities have access to testing.
Thank you so much. Have a great day.
Thank you.
From the Thompson Citizen, Ian.
Yeah, I'm just wondering what sort of measures are taken to fix places like Thompson, where a lot of healthcare workers come in and out on a 2-week basis. How is that addressed to reduce the risk of people coming outside the region?
Well, I think the same rules would apply, that there's still that stay home if you're sick, basically. And we have been in contact with some of the agencies that provide staff from out of province that they should stay at home if sick.
From CKDM, Matt, our final reporter.
No more questions from us. Thank you.
All right, then. Thank you very much. That concludes this afternoon's media briefing.